As a trainee myself, I often wonder, how can I use my assessment tools to help me with my own learning? Do you have any advice about this for us?
Yeah, well, I think first thing to say is we need to get the elephant out and start talking about it. Assessment sounds quite scary. It sounds as though you have to do an assessment and pass the assessment in order to progress. Now, of course, there is some truth in that. We'll come back to that. But what you're talking about there is summative assessment, by which means you have to pass it in order to progress. And like the membership exam is like that. There's many things in life a bit like that as well. But from that, we get this idea that you have to complete a certain number of assessments, tick boxy, if you like, in order to progress. And again, there is some truth in that, but I'm afraid to say I'm pleased to say that's not the whole truth. Far from it, because actually we have this other thing which we could call formative assessment, whereby you do something and it helps you develop as a clinician, as a paediatrician. It helps develop your skills and your abilities and your knowledge. And ask someone, look, I'm learning, about safeguarding, for instance. Can I do a safeguarding CPD with you? We can call it formative, and you can tell me actually how I could do it better. Okay? And that can go in your portfolio, and then you can learn much more from that. So if you do many more assessments than is required, you can use these formatively to improve your own skills as a paediatrician.
And could you tell us more about what you mean by formative?
Yes, so formative basically means you're doing it in order to develop your own skills as a paediatrician. So in practice, what you might do as a trainee is say, go up to one of your senior trainees or a nurse or one of the consultants and say, look, I'm learning more about, say, examination of the newborn or, putting UVCs in or whatever you fancy, safeguarding. Could I do a formative assessment with you? And then they can actually do that formally. That will go into your portfolio. You'll get some feedback from that as well. So in that way, you'll learn more about that, and you've got a documentation, a record of that.
Could you tell us more about what types of assessments there are?
Yeah, so basically they fall into kind of discussion ones like case-based discussions, and the practical ones like the clinical examination, and then the ones that are much more about how you behave. Okay, like I'll put a hat in there, which is a handover one, obviously, and the leader one, which you're going to use at different times to demonstrate different things about you. I guess the key thing is that you have to look across the portfolio of these different assessments to show how you're behaving in lots of different ways. Because actually that's one of the real challenges of being a paediatrician, is you have to be quite good at quite a lot of different things. You have to be fairly smart, you have to be good at learning things, you have to be good practically, you have to be good at communication, also working in a team, and also running a team as well. These are all quite different skills. So depending on where you are in your training, you want more or less of some of these things. For instance, we don't expect a lot of CEXs from our more senior trainees. Similarly, not that many leaders from our more junior trainees, because actually you're at different phases in your learning cycle. But one thing you might want to do at the beginning of each attachment is go and talk to your educational supervisor, make a plan. What do you want to get out of that particular 6-month or year period? Maybe it's really mastering how you assess a child, in which case probably lots of CEXs and CPDs might be where you go. Maybe it's actually working as a really functional level 2 trainee, and actually things like leaders and hats will be really important in that. But for some of the more senior trainees, it's going to be complex CPDs and leaders as well. And just on that point, Parisut, it's important to get the right person who's got some wisdom, expertise and perspective to give you the feedback. So particularly, things like MSFs are really important, but get a nice range. So perhaps some of your colleagues working at the same level as you, some nurses, some allied health professionals, and even some consultants to input on that. So you get lots of different range in that.
Perfect, great. Another question I have is what advice do you have to a trainee who might be struggling to get enough of these assessment tools done?
Well, it is an important part of every training unit that it assesses and provides assessments in this way for its trainees. And there is money in the system for that. For instance, your educational supervisor gets an hour a week for educational supervision of each trainee. So, there should be someone able to do that. Most people are happy to do it. Sometimes they need a bit of a nag, but usually the best thing to do is set something up beforehand, say, I'm about to do such and such. Could it be some sort of workplace-based assessment, and ask somebody who is going to be doing that proactively, and then do something about it immediately afterwards where practical, and then hopefully it can all get done very quickly and you'll get more accurate feedback.